All right, let's kick this thing off. So I wanted to start this week by just going back to review a couple of neurology concepts, because I don't think we talked about these in any sort of detail, and I just made the assumption that you guys are up on these particular terms, but I want to make sure that we're all on the same page. So when I say delirium and dementia, what do those words mean to you guys?
Delirium is like an acute onset mental
Good.
issue. Dementia
Good.
is chronic.
Good. So delirium is an acute onset of confusion, or it's an acute onset confused state, generally seen in patients that are in the hospital setting, in the healthcare setting, but not necessarily. It could be nursing home. They could be admitted somewhere, could be home health, those kinds of things. And yeah, you're absolutely right. So looks like my assumption is correct, that you guys are all okay on the difference between delirium and dementia. Yeah, fundamentally delirium is an acute onset confusion, and dementia is a chronic progressive disorder. And it's actually not one disorder, it's actually a constellation of different disorders. And over here I just outlined some of the more common ones. The most common form of dementia is Alzheimer's disease. You guys okay with that? Alzheimer's disease. And it's a complex chronic condition that involves protein malformation, or there are several components of it. One component looks to be protein malformation in the production of abnormal amyloid proteins, as well as probably or possibly some sort of inflammatory component to it as well. We're not entirely sure exactly what's going on there or exactly how to treat it, but we do see that. We do see a loss of acetylcholine neurons, and neurons that have a lot of acetylcholine-related activity, and this is associated with progressive loss of memory, changes in personality and behavior, and eventually these people become worse and worse, and they end up dying. Generally as a result of some other opportunistic problem. They either are unable to eat, swallow, drink, and they end up dying of an infection or aspiration or pneumonia, some other secondary cause. So that's the most common form of dementia. Probably the second most common form of dementia is something known as vascular dementia. And this is basically just like a coronary artery disease. This is just a chronic arterial disease of the brain where you have atherosclerosis and arterial sclerosis, and maybe you have lots of TIAs, and just over time, these small ischemic insults and this lack of perfusion results in just progressive damage to areas of the brain associated with memory and personality, and so it has a very similar presentation to Alzheimer's disease, except the cause is a little different in this case. And as you might imagine, this is going to be more common in patients that have like diabetes, hypertension, those kind of chronic comorbidities, smokers, and things of that nature. And then another one, I think the third most common form is something known as Lewy body dementia. And this is another abnormal protein formation. These are called Lewy bodies that form. And they're very similar to the amyloid plaques that we see with Alzheimer's disease. This is actually, interestingly enough, what you guys are familiar with Robin Williams, right? This is actually what they found upon autopsy. They thought he had Parkinson's disease. He was misdiagnosed. And they actually found that he had Lewy body dementia. And Parkinson's disease and Lewy body dementia actually have lots of similar presenting signs and symptoms. They can present with, obviously, with all the movement issues that we see with Parkinson's. And but with Lewy body dementia, of course, you can have a lot of the cognitive changes and the depression and loss of memory and so on and so forth. And that was likely the biggest contributor to his suicide, was the fact that he had, from what I understand, fairly advanced Lewy body dementia. And then another type, which is less common, is something known as frontal temporal lobe dementia. And this form of dementia is very different in that you don't necessarily have the cognitive changes, so you may have preserved memory with this, but the big thing that we see is a change in personality with preservation of memory. And then I just want to talk about the last one. This is the general forms of what we call rapidly progressive. Generally, dementia, it takes years and years to develop. This is a very rapid, progressive type of dementia that takes days to weeks. And probably the most common or the most prevalent form that we're aware of is something known as Creutzfeldt-Jakob disease, or quote-unquote mad cow disease. You guys familiar with that? And this is actually the result of a protein, something known as a prion. Have you guys ever heard of a prion, or prion, however you want to announce that? So you guys are familiar with what a virus is, right? A virus is basically a particle of genetic material that's generally surrounded by a capsule, and that capsule has a mechanism for attaching to host cell, and then there's basically an injection mechanism that once the virus attaches, the genetic material gets injected into the host cell. Well, this is even simpler than a virus in that it's just a protein, and it is a folded protein, and when it attaches to another protein, it causes that protein to fold abnormally, and then that protein attaches to another and another and another and another, and you have this unending line of protein malformations that results. So this is not a living cell. It's not even a virus. It is simply just a malfolded protein that causes basically more and more malfolding. And this tends to be fatal, tends to be very quick, and tends to be associated with eating the meat of other animals that are infected with this. We see this is very common in cultures where cannibalism is prevalent, such as Papua New Guinea, where they'd eat the brains. And so you'd see that. And there is currently some speculation that Alzheimer's disease may actually be the result of a prion type disease that we just haven't identified the protein. There is some evidence pointing to that. So we'll see what happens. Okay, and then going back to delirium, because delirium is an acute and potentially reversible problem, okay, we don't say that somebody has delirium per se. We say that delirium is a sign or a symptom of some other problem. And so here are just some other problems: hypercapnia, hypoxia, acute coronary syndromes, uremia, renal failure, heart failure, head injuries, being in lots of pain, being on a ventilator, having fecal or urinary retention, post-traumatic stress reaction, blood sugars too high or too low, alcohol and other drug withdrawal, malnutrition, dehydration, anemia, infections, medications, and just being hospitalized, just being taken out of your normal environment will make you more prone to developing delirium. So if we suspect somebody of having delirium, we need to aggressively assess for potential causes. Cool. You guys okay with that? So easy.